right. Hello, everybody. I'm Shelley Shanfield, a member of the League of Women Voters of Washtenaw County, and welcoming you to Lunch and Learn today. Our topic is the pandemic, public health, and politics. And I'd like to start by talking about a recent Stanford University-sponsored conference on the pandemic and its effects on public health, where former CDC Director Robert Redfield said, "We don't have a public health system." He noted that many thousands of state and local departments aren't linked in any effective way. He stated that the nation needs to invest in public health with the same rigor it invests in the military. Nationwide public health is certainly as important as a strong military. Indeed, it could be said it's an essential part of national defense. Yet we certainly are no closer to any top-down, efficient nationwide public health linkage than we were at the outset of the pandemic. That leaves local officials to resolve challenges on their own. The challenges can include bullying and threats against the safety of health officials. Just days ago, Lisa Peacock, health officer for the multi-county health department of Northwest Michigan, announced that she will leave her position on April 29th due to the hostile climate and threats against her. So we can see that stress on the public health workforce shows no sign of decreasing in 2022 as we enter the pandemic's third year. Workers are faced with difficult questions such as how to assess and prepare for the potential disease spikes with mask mandates ending or the possibility of new COVID variants. Our speaker today has the experience and drive to face these challenges. Jimena Loveluck earned an undergraduate degree from the University of Michigan. Then, inspired by her Chilean mother's activism in that country's politics prior to their relocation to the US, and by her mother's ongoing interest in women's rights, Loveluck earned a master's in social work from Boston College. She focused on healthcare and health equity, and in Boston, she worked in HIV services. Soon after she returned to Ann Arbor in 1999, she became director of Washtenaw County's HIV/AIDS Resource Center. In 2017, she joined the Washtenaw County Health Department as deputy health officer. And in 2019, 5 months before the COVID-19 pandemic struck, she became the county's chief health officer. And that was fortunate for the county's citizens. Working to implement state guidelines at the same time as advocating for county needs, she managed the multiple demands of her role with, in the words of one colleague, steely calm in the face of a really scary situation. The Washtenaw United Way recently named her Woman of the Year for her extraordinary leadership in implementing the COVID-19 response. The award recognizes women who make an impact in the community. Washtenaw United Way President Pam Smith says, "She never faltered. Jimena was steadfast, determined, connected to the community, transparent, and led with courage, which is really rare these days. A woman who uses her powers for good." Loveluck, in her own words, states, "In all of those things that I thought about doing, I think more and more of what formed for me was the importance of work in service to others and work in service of social justice. I grew up in a family that was very committed to issues of human rights and social justice." We welcome her to Lunch and Learn.
Thank you so much for that lovely introduction, Shelley, and good afternoon, everyone. Thank you so much for having me. Thank you to the League of Women Voters of Washtenaw County. I am very excited to be with you today and to talk about what is clearly a very timely and important topic. And Shelley, you already hit on some of the notes that I'll be emphasizing in my presentation. So thank you so much. I do have slides that I'm going to share. So if you bear with me for a moment, I'm going to share my screen and pull those up. So again, I'm very excited to be with you for this Lunch and Learn series on pandemic, public health, and politics. So in my presentation, I thought I would cover kind of three major areas. So first of all, starting out by giving you a little bit of background to public health in Michigan, how public health is structured, and the role of the Washtenaw County Health Department. I think more than any time, people are very much aware of the importance of public health in our local health departments. And so I really want to highlight some of the work that we do on an ongoing basis that doesn't get as much attention, particularly when we're not in a pandemic. I also want to talk about our COVID-19 response, partnership, and equity. And then finally, end with healthcare and public health issues as we look at elections and in general, as we think about voting and our representatives. So let me just start out by talking a little bit about the Washtenaw County Health Department and our role. First of all, obviously, we are a county health department. We serve all residents of Washtenaw County. We also work in partnership with our 28 local governments, our 9 school districts, and our 6 colleges and universities. In Michigan, we have a decentralized public health system. So we have a statewide health department, which is the Michigan Department of Health and Human Services. And then we have 45 local public health departments. Washtenaw County is a health department that serves a single county, but we also have jurisdictional health departments in parts of Michigan. So there are health officers and health departments that serve multiple counties. One of the things that is important to remember in our public health system in Michigan is that the power and authority held by the Michigan Department of Health and Human Services and the local health officers is really parallel. It's exactly the same, just different in scope. And that's founded in the Michigan Public Health Code, which I will talk about later on in my presentation. As a local health department, obviously, we are part of Washtenaw County government. I report to our county administrator and work obviously closely with many other of our county departments. We also, and of course, in Washtenaw County, have our elected Board of Commissioners, and we have an appointed Board of Health, appointed by the Board of Commissioners. Our Board of Health is an advisory board, but it certainly works in conjunction with the health department to advance public health and to advocate for public health resources. When we talk about public health, we really are talking about an emphasis on prevention and population health. And we recognize that there are many factors that affect health outcomes. And quite frankly, many of those have to do more so with the conditions in which people live. Things like physical, social, and economic factors, which we commonly refer to as social determinants of health. And so this is particularly unique to a public health approach, where we not only focus on the physical health, but we focus on population health, health equity, and really addressing the social determinants of health that impact health outcomes. Public health has essential core functions that can be categorized in 3 areas. Those include assessment, policy development, and assurance. And these essential public health services were updated in 2020 to bring the framework in line with current and future public health practice. And one important addition, if you look at the diagram, you see that equity is at the center of this circle. And that was an addition that was part of this revision in 2020, recognizing that all of these core functions of public health should be centered in equity and addressing and really lessening health inequities. So in our health department, our budget recently has grown, partly because of COVID. We have almost $18 million budget in our current fiscal year. Normally, we have just over 100 permanent staff and about 30 temporary staff. But during COVID, our health department grew by almost 50%. We brought on more than 69 temporary staff to help with COVID response. Our health department is state and nationally accredited, and we have 3 facilities, and many of you hopefully are familiar with those. We have our public health services in the Towner building, which is in Ypsilanti, and that's where my office is located and where I'm presenting from. We also have our environmental health services on the Zeeb Road facility, the Western Washtenaw County Service Center. And we also have a dental clinic that is a collaboration with St. Joe's and Michigan Community Dental Centers, and that's also located in Ypsilanti. Our health department is structured in 5 different divisions, and I'll highlight 4 of those, the 5th one being administration, which includes finance and myself, for example, as the health officer. So our mission is to assure in partnership with the community the conditions necessary for people to live healthy lives through prevention and protection programs. And our vision is a healthy community in which every resident enjoys the best possible state of health and well-being. And there you see our core values as well, which really one of the central areas that we continue to focus on and have even before the pandemic started is really promoting social justice and reducing health inequities. One of the things that's important to remember about local health departments and the services that they provide is that we provide an array of services that are both mandated and non-mandated. And those mandates come from different levels of government. So we have some state federal mandates, and you can see there the list of services and areas that we are required to provide. We also have county mandates, so county specific policies that may have to do with clean indoor air or on-site community sewage systems. So again, those are regulations that are generated at the county level and services that we are mandated to provide. And then, of course, because we know that there's so much more to public health and what it takes to improve health outcomes in our community, we have many non-mandated services. The challenge sometimes in these mandated versus non-mandated services is that mandates often are created without funding attached to those services. So a lot of times we're required to provide services really without adequate funding. And when Shelley was talking about public health funding and the need to invest in public health, this is a structure that has been longstanding even before the COVID pandemic. And I think it's really important to keep that in mind, that as we ask health departments and public health to do more, we need to be cognizant of the funding that's needed to support those services. So I'll just give an overview of some of the services that we provide, just to give you an example of the expansiveness of the work that we do. And I will say that what's been particularly challenging during COVID is that so many of these services either have not been provided or have been provided to a much more limited extent because of our need to redirect resources and staff to COVID response. Community health services is one of our divisions. It really houses most of what people think of as traditional public health services, including maternal infant health program services where we do home visiting for expectant moms and new mothers. We have children's special health care services that really focuses on young people who are diagnosed with a variety of conditions and illnesses that makes them eligible for other kinds of support services. Many of you, I'm sure, are familiar with WIC, hearing and vision, ongoing communicable disease and tuberculosis services, including communicable disease investigations, sexual health services, immunizations, childhood lead poisoning, and safe sleep education. So during COVID, we provided obviously what we are mandated to provide. Those services continued while we were addressing COVID. But we know that in some of these areas, because we haven't been able to focus as much We know that we have fallen behind and that our community members have fallen behind in accessing some of these services. In particular, for example, we are concerned about immunizations and childhood immunizations and getting our kids back up to speed or up to the schedule of those immunizations. We also have environmental health services. This is a different division. It is more of the regulatory arm of the health department, and it really is driven very much by different regulations and licensing that is required in our county. So when you think about eating at a restaurant, which many of us haven't been doing as much because of COVID, but when you think about eating at a restaurant, it's the health department that is inspecting that restaurant twice every year. The environmental health services also works closely with communicable disease as we investigate foodborne illnesses. And of course, more and more we know about the importance of protecting safe water and drinking water. So septic systems, drinking water wells, pollution prevention, all of those programs are so important when we think about our environment and environmental health. In addition, we inspect public swimming pools, we inspect some daycares, we inspect body art facilities, and of course, we monitor public beaches. We often have had to issue notices because of some algal growth or other kinds of bacteria in water. Those are all things that we are mandated and required to do and have continued to do during COVID. Another division of the health department is community health promotion. And this is where a lot of people think of health education. But community health promotion is a fairly expansive role that we have in the health department. And it really is grounded in our community health assessment, which is a process by which we gather data, review data, and really work in partnership with community members to identify community health priorities. The community engagement piece is really a critical aspect and foundation of our community health promotion work. And our community health promotion work is broad. It addresses everything from healthy food access to tobacco prevention, suicide prevention, medical marijuana. And this is also where we have our communications team. We know that for public health, it is incredibly important to be able to provide public information on health issues, emerging health matters in a timely and effective manner. So we not only develop educational campaigns and health promotion campaigns, but certainly we alert the public to any health conditions or concerns. And during COVID, you can imagine that our communications team has worked nonstop to ensure that accurate information is available and accessible. And so that means making sure that our materials are available in multiple languages and that we use multiple communication strategies to ensure that that information is getting to people in need. The Washtenaw County Dental Clinic, as I mentioned, is based in the Hobb Building in Ypsilanti. It's a partnership with St. Joe's and My Community Dental Centers, and incredibly important as we want to ensure access to dental care, particularly for people and families who are low income and uninsured. And then finally, emergency preparedness. Clearly, this has always been a function of public health and local health departments and has been a great focus during COVID-19. I would say that we think, when we think about our public health services and funding for public health, there's very limited funding for emergency preparedness. And I think that's one area that clearly we will need to focus on moving forward with public health. But in emergency preparedness, we use an incident management system so that we can quickly respond to an outbreak, a pandemic, any kind of natural disaster. And it's a system that we used early on as we were responding to COVID-19. It really helps shift resources and staff to areas that are needed in the response. We also have a huge group of volunteers that have come together during COVID-19, particularly the volunteer group, which is our our Public Health Reserve Corps. They have been in existence before COVID, but during COVID-19, we had an outpouring of community members wanting to volunteer and to help. And we could not have done, for example, our mass vaccination clinic without all of those volunteers. So in general, with public health, we always are responding to emerging issues and outbreaks. And before I became health officer, these are some of the things that we had responded to or continued to respond to, whether it was the opioid epidemic, the dioxane plume, lead poisoning, or outbreaks, smaller outbreaks that we saw. In 2017, we had a hepatitis A outbreak. We had, in 2019, we had more cases than ever of Eastern equine encephalitis in Michigan. And so the importance of this is having the capacity and flexibility to respond to emerging issues and outbreaks, and really being able to shift resources quickly. And we certainly have had lots of experience in that in the past couple of years with COVID. So hopefully that gives you a sense of the health department, the role of the health department, the types of services that we provide. And so now I'm going to shift to talking a little bit about our COVID-19 response. I have to say, it is almost exactly 2 years. On March 10th, it'll be 2 years to the date that we confirmed our first cases of COVID-19 in Washtenaw County. And as Shelley mentioned, I became health officer in September of 2019. My first major public health issue that I had to deal with was in the fall, in October, having to deal with Eastern equine encephalitis, and a decision that was made by the state in conjunction with local health departments to do aerial spraying in order to limit the spread of Eastern equine encephalitis cases, both in animals and humans. So I thought that was a pretty challenging experience. Little did I know that just a few months later, we'd be preparing for COVID-19. So most of my time as health officer has been during COVID-19 in this very intense response phase. And one of the things that, as I think back to the early days as we were preparing for COVID, because we didn't have cases until March, but we were spending, I would say, February, starting in probably late January, we were preparing because we knew that it would just be a matter of time before we had cases in our county and would be responding as well. In those initial days, we were, first of all, there was no testing locally, no testing in Michigan. Every test had to be sent to the CDC. So as we were screening travelers returning from Europe, returning from Asia, we were identifying people that were suspect cases, and we had to send the tests to be processed to CDC. And then I just remember waiting on pins and needles to get those test results. And we were testing people for a few weeks before we actually got our first cases. But that's what it was like at the beginning, reviewing the possible exposures, identifying close contacts, and really preparing for what we knew was coming. So in this arrow that you see in terms of response phases, when you look at that initial planning and coordination, that is what we were doing. We were also preparing for our incident command structure. So really changing the structure of the health department so that we could rapidly respond to cases and the work that we knew was coming. Of course, as 2020 went on, we saw many, many more cases, people unfortunately with severe illness, hospitalized, and sadly, many community members who died. we were challenged to increase our case investigation and contact tracing. That was a particular focus in 2020. And that's what started many of the new staff coming on board, because there was no way we had enough staff to keep up with the case investigation and contact tracing that was so important in the initial phases of the pandemic. We also had staff that completely shifted their roles. So our sanitarians who normally go out and inspect restaurants, they were doing case investigation. We had health educators that shifted to do contact tracing. And so people also in the health department were shifting and learning new roles as we were learning about COVID. Of course, we were also at a time when there were many local and state orders. And again, this comes from the Michigan Public Health Code and the authority of the state and local health departments, as well as the governor at that time. And so we were on lockdown. We had lots of different orders that either, limited capacity, that required masks, all kinds of orders that we saw needing to be put in place at the state level and the local level. And one funny anecdote I'll share about a very serious decision around local orders. I remember reaching out to the previous health officer, Ellen Rabinowitz. Many of you may know her, and she retired and was a great source of support for me as I started as health officer. And I remember I was preparing to issue my first local health order. I believe it was, I think around St. Patrick's Day in 2020. And I remember calling her and saying, Ellen, I really need some guidance. Please tell me, how did you approach issuing local orders? Tell me how you did that and what more I need to think about, or what am I missing? This is, my plan. And she said to me, Jimena, I have never had to issue a local order. And so I thought, oh my gosh, this is new territory. This is new territory, not only for me as a new health officer, but new territory for so many of us in public health, preparing and responding to this pandemic. Of course, as 2020 went on, and as we've gone through 2021, we've seen different surges in COVID cases, and we've seen our hospitals get to their breaking point, quite frankly, in terms of capacity, and healthcare workers and public health care or public health workers just driven to the point of exhaustion and burnout. We were very excited when 2021 came along and we had vaccines. We thought, okay, this is going to be the end of COVID, and as effective as vaccines have shown to be in terms of preventing serious illness and hospitalization, we were incredibly challenged in early 2021 with a very limited supply of vaccines and very specific prioritization that was set by the state, following direction from CDC about who was eligible to receive those vaccines. So as we were so excited about the start of 2021, because we knew we had this incredibly important new tool in our COVID vaccines, it was probably one of the most challenging times in our COVID response because of that limited supply of vaccine, so many people wanting to get vaccinated, justifiably so, and having to prioritize different populations, and at the same time ensuring that we were keeping equity as our compass. So that was an incredible challenge. It's great to know now and to be in a situation where vaccines are plentiful. Of course, we wish that we had higher vaccination rates and hope that people will continue to make that decision to get vaccinated and get boosted. But that was in early 2021, an incredible challenge that we had to deal with. So today, this is a graph from our health department website, and I hope many of you have looked to our website and other resources that we share. Our surveillance data has grown in terms of what we have available, the information we have available, and it's been really important from the beginning for us to make this data accessible, and of course, to make data-driven decisions. So this graph is a depiction of COVID in Washtenaw County from the very beginning. And you can see the various surges that we've experienced, but none so great as our most recent surge, which really began with Delta and ended with Omicron. That brought on the highest case rates we'd seen since the beginning of the pandemic, as well as the highest hospitalization rates. Luckily, as you can see, we have come way down from that very, very high point. And we are certainly hoping that those trends will continue. But as we think about 2022, the third year of COVID, we know that we are in a different place than when the pandemic began. We have many more tools that we know are effective in preventing serious illness and hospitalization. Most importantly, vaccinations, but we also have many more treatments. We have monoclonal antibody therapies. We have antiviral treatments. We also have much more testing available. I know testing during Delta and Omicron also felt the strain and was very challenged in terms of its capacity. And if you were looking for a home test kit, it was very hard to find. So no doubt, supply has not always been plentiful, but the fact that we have home testing available, that we have many more testing sites than we did early on in the pandemic is also really important, as well as making sure that those resources go to communities and areas that we know have been disproportionately impacted by COVID. And so in our data sharing, we were one of the first local health departments to really highlight what we were seeing in terms of this disparate impact of COVID-19, particularly in the African American community, in the Latinx community, in the 48197 and 48198 zip codes. And so for us, again, in our response, as we share resources, as we deliver services, really prioritizing those populations, those geographic areas that we know have been hardest hit by COVID continues to be a priority for us. And then I talked a little bit about our communications, obviously incredibly important, and I would say more challenging than ever during this time of mistrust of public health and mistrust of reliable science and data. So in 2020, just to give you an example, just in that year, our team talked with an estimated 46,000 residents about their COVID-19 illness or exposure. Just to give you a sense, just in 1 year, that is how many people we spoke to directly and provided support as they were ill with COVID or had been exposed. We also saw an incredible growth in our communication, particularly related to our website and our social media engagement. You can see the comparison from 2019 before COVID, the growth we saw in 2020, and the growth we continue to see in some cases in 2021 in last year. Again, the importance of getting information out in a timely manner. We know that as we have learned more about COVID-19, public health guidance has changed. We want to make sure that we are providing the most updated, accurate information. And again, really thinking about how that information is available in the most accessible form. So, of course, we don't rely just on our website, just on social media. We created a whole team to help answer phones so that people who don't have internet access, who can't make appointments online, for example, are able to call and talk to someone and still get that same information and assistance. And of course, developing materials in multiple languages and really working with community partners to ensure that messages are delivered by trusted messengers. I talked a little bit about our vaccination efforts that began in early 2021. This is where we stand in terms of our vaccination rates in Washtenaw County. And I have to say, Washtenaw County, compared to many other counties in Michigan, has among the highest vaccination rates. I think we still lead the state in our vaccination rates among 5 to 11-year-olds. Our Washtenaw County Health Department has provided more than 117,000 doses of COVID-19 vaccines, and we continue to promote vaccination. We provide vaccines here at the health department, and we also work with community partners to plan community clinics. So, for example, we were just out in Manchester yesterday providing vaccinations, and we continue to do that in a way to ensure accessibility and equity in the vaccinations. I will also say that the vaccination rollout, when it began in early 2021, this is where the partnership with St. Joe's and Michigan Medicine was so important, because really at the beginning of the vaccine rollout, it was just the health departments, health systems, and then some pharmacies that were getting vaccine supply. And so we really worked together to coordinate our vaccination efforts, to review what supply we had, to review the priority populations, and to ensure that we were providing those vaccinations in the most accessible manner. And that meant sometimes sharing some of our vaccine supply with some of the health systems. It also meant the health systems chipping in and helping support our vaccination clinics. For example, a great partnership happened with Michigan Medicine and St. Joe's as we were able to vaccinate teachers and other school staff. So that coordination was incredibly important and has continued throughout this time since the beginning of the vaccination rollout. So I started talking a little bit about that, but just wanted to highlight the importance that partnerships have played in our ability to respond during the COVID-19 pandemic and really continue to center equity in our response. No doubt, we have worked very closely with our healthcare systems from the beginning. That included identifying suspect cases, getting them tested. And when testing was so limited at the beginning of the pandemic, working with Michigan Medicine and St. Joe's to host pop-up testing clinics. We worked with them from the beginning. And then, of course, as I said, throughout the vaccination rollout. And for us as public health, we want to do everything we can to preserve the capacity of our healthcare systems. And so as we were experiencing different surges, and particularly most recently with the Delta and Omicron surge, we have really focused on ensuring that what we're doing is focusing on vaccination, testing, getting resources out to the community like our KN95 masks, doing everything we can to ensure that we preserve the capacity of our healthcare systems. Because as we know, not only were they overwhelmed with patients who had COVID-19, but we also know that many other people in need of medical care were challenged in terms of getting that medical care because our healthcare systems were so overwhelmed. So really that partnership has been essential as we have dealt with limited supply or availability of services and resources. In addition, we've always worked in partnership with our local universities and colleges, but I think that one of the things I would reiterate is that during COVID-19, these partnerships have really grown and been strengthened. And I think that that is something that we really think about at a local level and as a local health department as we move beyond COVID-19, or we think about, COVID-19 entering a more endemic phase. really how we preserve those partnerships and continue to build those, because they really have been in many ways strengthened because of COVID-19. In particular, our largest university in the county, the University of Michigan, we actually have deputized in some ways the University of Michigan to carry out some of their public health role, or some of the public health role that we would play. So for example, they have an environmental health program where they are able to do disease investigation, foodborne illness investigation. And again, of course, that is in partnership with the health department. So as we prepared for COVID-19, they were also preparing to have their own system for testing, for case investigation and contact tracing. And then most recently, for vaccinating their staff, students, and faculty. And so we have worked really closely both with the University of Michigan and Eastern Michigan University to ensure that those campuses are safe. And of course, during challenging times when there was remote learning, we were on lockdown, and as universities thought about bringing students back, ensuring that we were prepared, we were working together and had good communication so that we could address any outbreak quickly or any particular surge that we might see on campus. And we did have to issue some local orders that particularly impacted our local universities. And I'll talk about that in a little while. Of course, we have always worked as well closely with our K through 12 schools, but certainly more so during COVID-19, particularly as they have come back to in-person education, really working closely, ensuring that they have the resources and guidance to preserve in-person education and do that as safely as possible. During COVID-19, we also have worked closely with businesses, for example, our restaurants and other service industries, to ensure that their staff are safe and that they're understanding all of the mitigation measures that we recommend and that are available to ensure safety. We also have worked very closely with churches and faith leaders, local units of government, and of course, community organizations and groups. There are so many community organizations that are instrumental to the safety net in our county, and so many of them continue to work throughout the pandemic. And we wanted to make sure that we were doing everything possible to provide them with guidance so that they could do that as safely as possible. I wanted to spend a little bit of time just talking about the Michigan Public Health Code, because I think the authority of local health departments, particularly health officers and the state health department, are embedded in this Michigan Public Health Code. And it certainly is the source of much, I think, controversy and disagreement as we have responded to COVID-19. And often there is a lack of understanding about the authority that is embedded in the Michigan Public Health Code and how that is different than, for example, a governor's executive authority. So in Michigan, we have PA 368, our public health code that was created in 1978. It is one of the most comprehensive and contemporary codes in the nation. It allows the state health department to grant local health departments authority to act on its behalf. So again, when I mentioned at the beginning that there are sort of parallel powers, that's what I'm referring to there. And local health departments, of course, we provide services in response to federal and state laws, administrative rules, and needs identified by federal agencies like the CDC, as well as local needs that we identify through our community health assessment process. So the local health officer authority and action covers all of these different areas. We obviously are most familiar in recent times with emergency orders to control an epidemic. But just to give you an understanding of the authority that's part of the Public Health Code, we also can place procedures that might be needed to control disease. We're able to inspect or investigate if needed, if related to a public health matter. We also obviously have quarantine orders that we can issue. So these are all sort of authorities that have existed as part of the Michigan Public Health Code, but I think have never been used as broadly as they have than during the pandemic. And we've seen that at both the state level and the local level. So just to give an example of some of the orders that we've seen and that I've issued locally, I mentioned there's an example there on the left, Washtenaw County to restrict size of outdoor gatherings and events. As the University of Michigan and Eastern Michigan University brought back students in person on campus, we wanted to ensure that we were able to limit the size of gatherings. We knew at that time, in particular, before having vaccines available, that was a really important measure to ensure and limit the spread of COVID-19. But we've issued orders related to other things as well. So early on, there were orders to protect essential workers, to designate shelters for isolation and quarantine, particularly for individuals who did not have a safe place to isolate or quarantine, or might have been homeless. We had a stay-in-place order that was issued in October of 2020. For U of M, as we saw a surge of cases on their campus. And then most recently, we have had orders since the beginning of the school year requiring masks in our K through 12 schools, as well as isolation and quarantine. And many of you probably have seen that those local orders are going to be lifted on Monday. I think that when the Supreme Court made their decision and ruled about the governor's executive orders and executive power, there was a lot of confusion about the limitations set now by that Michigan Supreme Court decision, and the separate authority that is part of the Public Health Code. So really, even though the Supreme Court ruled in that way, it did not impact the authority that exists under the Michigan Public Health Code. And so you can see this is from the fall of 2020. We were getting lots of questions, lots of challenges to our ability to issue local health orders. And so it was important to clarify that. And we continue to clarify that as we have experienced different challenges and disagreements with local health orders. So now I'm going to shift a little bit to talking about the political side of public health and what's impacting public health, and what I think as voters who participate in elections we should be thinking about and aware of. First of all, Shelley already mentioned my good colleague here, Lisa Peacock. I'm so glad that you mentioned that. Lisa Peacock and so many other health officers and public health leaders have just incredible responsibility, but also incredible expertise in doing their work. And no doubt this has been one of the most challenging times. So you can imagine what a loss it is to public health in Michigan to have a health officer like Lisa Peacock resign. And the reasons for her resigning are all about the use of her authority, which is done with the responsibility we have to protect public health. And we've seen many health officers leave during the pandemic, resign during the pandemic, be pushed out, and even more be threatened, as well as our public health workforce. It has been exhausting and challenging, to say the least. According to Kaiser Health News, all 50 states have have legislatively proposed bills to curb public health powers since the pandemic began. In Michigan, we have Unlock Michigan 2.0, which is a petition that is seeking to gather enough signatures to propose restricting the authority of health officers and the state health department directly in response to the COVID-19 pandemic. We also have a group called Public Health Over Politicians, which is really seeking to ensure that we not only preserve the authority of the Michigan Public Health Code, but that we support public health leaders and public health officers in giving them the ability to do their job and to really respond to the next pandemic. Let's hope that doesn't happen anytime soon. I also want to highlight the connection between voting and public health. This is a diagram from the Health and Democracy Index. Not sure you can see all of the different states there, but really the diagram showing the connection between voting access and health outcomes and where states land in terms of that access. There's no doubt that states with more inclusive voting policies and greater levels of civic participation are healthier. So, for example, rates of infant mortality are higher among Black and American Indian communities than white communities, but this disparity shrinks for all racial and ethnic groups in states that have better civic participation. So one of the things that I think I want to reiterate is just the connection between public health and voting. So even before we get to talking about an election or a specific policy or platform, ensuring that everyone who is eligible to vote is registered, that we make voting accessible, that we really combat restrictions that are more and more impacting people's ability to vote. So that's one thing that I really want to highlight as we think about politics, public health, and the connection between voting and public health. We also are working, and there's kind of a nationwide effort to get voting metrics back as part of Healthy People 2030. It was part of Healthy People 2020, the number of people that are registered to vote, for example, in a community. It was removed. And so we really want to see that back to be a health outcome or a health-related outcome measurement and put that back as a goal for Healthy People 2030. The other thing, I've talked a lot about health equity, and the other thing I just really want to emphasize is related to health equity and social determinants of health. And so as we think about public health, yes, we absolutely need more investment in public health. We need to ensure that the authority of public health to intervene and to protect the public in the situation of an outbreak or a pandemic is preserved. But we also need to think broadly about the areas that impact health outcomes. And that is not just limited to what we might think of as health or public health. It is all of the living conditions in which people work, play, worship. So thinking about policy related to housing, related to transportation, related to exposure to environmental toxins. Those are all things that impact public health, that impact health outcomes. So as we really work to address health inequities and we think about our elections, thinking about broadly the social determinants of health and understanding that it's not just what is healthcare related or public health related, but it's broader system-wide thinking so that we can address policies that really will consider those social determinants of health and move the needle on health inequities. Some of the things that I want to specifically call out in terms of as we think about voting and elections, Policy issues that really have been brought to the forefront during COVID-19, starting with universal health care coverage and health insurance. We know that this continues to be an incredible barrier to health outcomes and addressing health inequity. And so that is one area that I think more than ever has been highlighted during the COVID-19 pandemic. Also, protections for essential workers. We know that essential workers were so impacted during COVID-19. They couldn't stay home and work remotely. They couldn't take time off when they got sick, or they wouldn't be paid if they did take time off. So again, really the protections for essential workers, as well as housing and affordable housing and stable and safe housing. COVID-19 certainly brought to light the impact that being houseless or having crowded housing conditions impacts people's ability to isolate and quarantine. What we need to do to ensure that people have safe housing. Those are all things that I think have been incredibly importantly highlighted during COVID-19. More and more, we also need to think about environmental justice and climate change. We certainly in our state have been dealing locally and statewide with the impact of PFAS. We also know, not just in Flint, but we know now the impact that lead can have in terms of safe drinking water. We've seen that in Berrien County, and most recently in Manchester, here in Washtenaw County, we had to address and respond to a lead exceedance in the drinking water. So again, really thinking about environmental justice and climate change policies and issues. And then finally, thinking about this approach that we call health in all policies, so that we can do a better job of addressing social determinants of health. Health in all policies is a collaborative approach that integrates and articulates health considerations into policymaking across sectors so that we can improve health of all communities and people. And that kind of goes back to that chart that I was showing about health equity and really thinking about upstream policies that impact health outcomes and public health and can address and lessen health inequities. So that is my contact information, my email, and obviously, of course, I hope you are all connected with the Washtenaw County Health Department, but if not, here's our website, and you can also follow us on our many social media channels. So with that, I will stop sharing my screen, and I am happy to answer questions. So thank you so much for your attention.
Wow. Thank you so much, Jimena. That was just amazing. I'm going to pull up my list of questions here. And I think you really addressed very well all the questions I sent to you earlier. So I want to ask a couple that came from our attendees. Okay. We had one from Edith Kiefer. Who's
Hi, Edie.
I thought the name might be familiar. So she has two questions. Since home test results are not reported, how will the county monitor report COVID status to the public?
Hi, Jimena.
Will reporting rates of hospitalizations and deaths be expanded? Also, well, why don't you address that, and then I'll ask you her second question.
Sure. Thank you for the question, Edie. It's a great question. We home testing became something that really started growing, and even though it was limited in supply, people were doing it more, starting with the Delta and then Omicron surge. And unfortunately, with the health department dealing with just, I think, thousands of cases that got reported to us every day from testing sites, we did not have the capacity to really kind of collect information about those test results. So we don't have a requirement or a request that people send us that information. I think as we move on, we'll be looking at how to capture that information more accurately. But I think what we did do, what we really focused on, was making sure that people knew what to do if they tested positive. And so at the end of 2021, right over the holidays, I think right before the new year, CDC changed their isolation and quarantine guidance. So as we were in the midst of the surge, really important to make sure that people knew what the guidance was, how it had changed, and what to do if they tested positive. And so that's kind of where we focused to make sure that people knew what to do and had those resources. Now, certainly, we have, we report cases. Those come mostly from, healthcare providers, other testing sites. In terms of hospitalizations, we continue to keep that updated. And our hospitalizations that we report on our website, we're very careful to review the data and the medical records and the documentation that we have to ensure that those are hospitalizations due to COVID. Because the other thing that we saw, particularly during the surge, is that there were a lot of people who were hospitalized, but not because of COVID, but they're tested and they have COVID. And so really kind of ensuring that our data accurately reflects those COVID hospitalizations. I think the other thing too that I'll say is that as we have learned more and experienced more during the COVID pandemic, the metrics that we use and the emphasis that we place on those metrics have changed. And case rates is one of those metrics that it's not something, I won't say we don't pay attention to it, but it has become less of a priority metric in terms of our evaluation of kind of the current situation with COVID. We saw with Omicron, we had this incredibly transmissible variant. Our case rate went, through the roof. What we were really focused on was the hospitalization rate and looking at that. So again, the metrics also and sort of the emphasis on the metrics, what we prioritize in terms of those metrics as a way of assessing where we are and our response has also changed over time. Yes. I hope that helps answer the question.
Yeah, I was just concerned that they talk about the rapidly declining case rate, and it really doesn't mean much because so many people aren't reporting. So we need to have a different metric that we are able to use for surveillance and public information.
Yes. Yeah. And with testing, we always see like a lot of times as, we have a surge, there's a demand in testing. And then as cases go down, our testing numbers, even at the traditional testing sites that we do have, go way down. So testing also kind of follows those curves.
Thanks for a wonderful presentation too.
Oh, thanks, Edie. Great to see you.
So I'd like to go to Edie's second question, which is people over 65 and those with chronic conditions are further marginalized and isolated as mask and vaccine requirements are further eased. How can the county help mitigate this?
Well, I think it kind of goes back to thinking about the sort of new tools that we have. And of course, I would start by ensuring that everyone who is eligible to get vaccinated is vaccinated and boosted, right? I mean, that continues to be a major focus for the health department. The other thing is making sure that we're helping people who are eligible access those therapeutics and treatments that are available. And in many cases, because again, there's limited supply with those, in many cases, the criteria is in the favor of older people, because certainly we know older people are more vulnerable to severe outcomes. I think the other thing too is that we recognize that while we don't necessarily have orders in place, we want to ensure that people are able to kind of make their own assessment of risk and have the resources that they need to protect themselves. So making sure that our seniors and vulnerable community members have access to home test kits, to masks. That's something that we've really focused on since the beginning of the year. We have distributed, I want to say, almost 115,000 KN95 masks, really through community-driven distribution efforts, as well as almost 25,000 home test kits. And we prioritize people who are recently exposed to COVID, who can't or have trouble accessing testing sites because maybe they don't have the transportation or they have other barriers. And really, again, prioritizing neighborhoods and communities that have been disproportionately impacted.
Okay. I had another question from a member. Is a new mutation of COVID-19 about to envelop the world? And kind of a corollary of that was, can we speed up vaccinating the world? And a concern that certain vaccines expire while US citizens, that we have expire
Yes.
while our citizens refuse to be vaccinated.
Yeah. I think all of us wish we had a crystal ball to be able to see what the future will bring. We know that there will be new variants. And right now there's, sort of a sub-variant of Omicron that is being sort of watched. I think, though, the general thinking among public health experts and people who, study the epidemiology of COVID, that between the number of people, and I'm talking just, locally here, but between the number of people that have had COVID and the number of people that have been vaccinated, we probably have the highest level of immunity than we've ever had in the pandemic. Now, of course, that doesn't mean the immunity is forever. It doesn't mean that a new variant couldn't come and evade vaccinations. But I think that as we continue to have more people having had COVID, more people getting vaccinated, the ability for a new variant to take hold and cause massive surges like we've recently seen, I think will lessen over time. Now, that doesn't mean that we should stop our efforts to vaccinate everyone who is eligible and continue to try and help people get vaccinated if they haven't already. That will continue to be an effort. But I think that, we may be moving into seeing this perhaps be more seasonal surges or outbreaks that are more limited in the impact. I couldn't agree more that we need more of the world vaccinated. This is a global pandemic, and the less vaccination or the less people are vaccinated in other parts of the world, the more opportunity that creates for new variants. So absolutely, I couldn't agree more that we need to do everything we can to ensure that there is equitable access to vaccination, not only in our community, but globally.
Okay. I think that there were maybe some questions in the chat, so I'm going to ask Deshawn to tell us what those were.
Sure. There's one here. What can we do to get vaccination requirements for restaurant patrons in Washtenaw County?
I think that's a challenging, thanks for the question. It's a challenging question. Certainly private businesses are, have the authority to, make those decisions around vaccine requirements for their staff, for example, or if they wanted to set a vaccine requirement for their patrons. I think right now it would be a particularly challenging time to try and put some requirement like that in place, as we see major cities actually lifting their vaccine requirements for restaurants and other places. I think we are at a time where the public appetite for orders and restrictions is at an all-time low. So I think for a business, they also have to weigh the impact that it has to their business. And certainly there are a lot of other things that can be done to ensure that going to a restaurant, for example, is safe. Like ventilation, for example. We don't talk a lot about ventilation, but ventilation is an incredibly important aspect to COVID mitigation. So whether a restaurant can evaluate its ventilation system, improve its ventilation system, that goes a long way in mitigating COVID. So I'm not sure that that's something that you will see, countywide, or really even individual businesses doing that. Now, for example, I think should we, if there were, and I hate to even say it, but like if we experienced another variant that evaded vaccinations, that, really caused, very severe illness, I think we would see more of a willingness to kind of put other requirements or restrictions in place again if needed. I am happy to say that I did go to the University of Michigan women's basketball game yesterday, and they check vaccination status as well as negative test results. So I think that's certainly been working for them. And again, don't know how able local businesses are to put those kinds of requirements in place.
We have another question. How do you explain Michigan's place in the voting and public health matrix? Good voting access, lower than average public health. How come?
I don't really know the answer to that. I did obviously look at that. I haven't looked at our state specific data, but I think that Michigan overall, in many of the major public health kind of health outcome indicators, is starting at a deficit. And so I think that there's certainly a lot of work to be done in terms of improving public health outcomes in Michigan. And also really in our county, part of the impact of that is the economic segregation as well. So I think it might have to do with sort of Michigan's general public health status, and not necessarily a direct correlation between the voting and the public health status there. But I can't say for sure because I haven't reviewed that data specifically.
Thanks. That looks like all that we have here, except for the announcement. And if folks have not checked chat yet, check it out because there's some good links. And it was asked about, will this recording be available? And yes, check our League of Women Voters Washtenaw County website, Facebook page, YouTube channel, lots of different places to see this again. In case you missed some of those slides or dozed off for a second, I can't imagine you did, but if you'd like your friends to know as well. So I think we're all set, Shelley.
Actually, there is one more question in chat. If there's time, can Jimena talk briefly about the different icons in the beautiful logo? I can parse a couple, but I'm not sure about all of them.
Oh, yes. Thank you for that. One of the things that happened right as I started at the health department was a rebranding process for the health department. So our logo really tries to reflect all the areas that we address in public health. We have a drop of water, which is the blue starting on the left. We have a hand, just because we are helpers, a heart, in terms of, health and improving our work to improve health outcomes. There's a house sort of impacting or showing the impact that we have in terms of healthy homes and healthy neighborhoods. And then there's a leaf to give us more of the, kind of climate and environmental health aspect. So those are the little icons on our logo.
Edith Kiefer has her hand raised.
And just thinking back to I just put it finally in the chat, but thinking about the topic of today and the threat which health directors, staffs, and the code itself are under.
Mm-hmm.
I was wondering if between certain legislators, local health department directors, maybe the state, have discussed strategies for protecting what remains of our system and helping to rebuild it, thinking about the role of the League of Women Voters and its members that might have an opportunity to help.
Yeah, thank you for that. Certainly, this is a topic that we discuss. We have a statewide public health association, the Michigan Association of Local Public Health. So we work closely with, advocacy efforts with our legislators, and we also are kind of loosely connected to the Public Health Over Politicians group as well. And so we're really focusing on there being advocacy and also just awareness about through Public Health Over Politicians about Unlock Michigan, the impact that petition and could have, as well as really educating the public about the public health code, the importance of public health and public health authority to respond in a crisis like COVID-19. So I would certainly encourage you to check out Public Health Over Politicians. And if there are other, thoughts or suggestions that come out of your group, please send them my way, because this is something that we are really focused on in some indirect, in some indirect ways through mouth as well.
I actually have a question about statewide and nationally. It's my understanding that even statewide, like every health department, public health department has a different way of recording and reporting their statistics and reporting their data. And if you had a magic wand and could, and could make the coordination of data simpler, what would you do? How would you, what would you recommend in that area?
Yeah, that's a great question. And actually, it's something that I think because of our experience with COVID, there's a lot of work that's starting to be done to look at our public health information systems, particularly something that we call interoperability, right? So, we have a state, for example, we have the Michigan Disease Surveillance System. So that's what we use to report our COVID cases. But that system is different than what Ohio uses. It's different than what CDC uses. And so I think interoperability or ways that we can facilitate more easy sharing of data is just so important. And we saw the challenges with that. Our Michigan Care Immunization Registry, where we've been documenting all of the COVID vaccinations and other immunizations. We know that when COVID vaccines were were limited in their availability, there were people going to Ohio to get vaccinated. Well, that's not data that's reported in the Michigan immunization registry. And the challenge of trying to get that data from a different state, there was no easy way to do that. So again, really having data systems that can talk to each other, that can share information more easily. And I just have to say, I laughed. I don't know if any of you saw early on in the pandemic, there was a New York Times article that talked about how many public health departments rely on fax machines. And I laughed because we literally have a fax machine where we would get hundreds of pages with COVID results. So that is real. And so that gives you a sense of the need to address our data and information technology and structure in public health. And I'm certainly hopeful that because of this experience, we are going to see improvements in our state systems, our national systems, as well as locally.
Thank you for that answer. I want to thank you so much for this incredibly informative presentation. And after seeing it, I have to thank you even more because I realize you must have a million things to do. And so I'm very grateful that you took the time out to speak to the League of Women Voters of Washtenaw County. And we will do our best to publicize this recording widely so that we can inform even more people of these issues.
Thank you so much.
Yeah, so to everybody, this Lunch and Learn will go on hiatus after today's presentation. It's been an honor to host these programs. At our monthly noon sessions, we've heard speakers on many vital issues from police oversight to climate justice to domestic violence affecting not only our local members, but voters beyond Washtenaw County. It was a great privilege and pleasure to work with the program committee Chair Donna Crutter, Vice Chair Teresa Reed, and Rena Bash on the Brews and Views and Lunch and Learn programs. And a shout out to advocacy committee members Sandy Serini Elser, Vicki Paulison, and Kathy Weinman, who were essential to last fall's series on climate justice. But it is time for me to move on to new responsibilities in this election year. My own efforts will focus on the Washtenaw County League's Communications Committee, which keeps membership informed through the newsletter, social media, and other channels. While Teresa Reed and I have stepped away from these programs, the need to invite experts to educate our members on issues crucial to good government remains. If you are interested in opportunities to develop programs to fill this need, write us at league@lwvwashtenaw.org and watch for details about potential future events via email on our website at lwvwashtenaw.org or on our Facebook page, facebook.com/lwvwashtenaw. So I'd like to thank Jimena for joining us. I'd like to thank our participants for joining us. Stay safe, stay well, and stay involved in your local government. Thank you.